Hello, Assalamu alaikum. In this video, we will understand about the type of headaches. So remember the type of headaches we will classify in this video, but the primary causes and secondary causes. Secondary causes is due to another like abdominal pain, which that cause and abdominal problems or other problems. So here is the throbbing, the uncomfortable and distracting pain of headaches, which that is the we will understand the common pain first. So we can classify the common pain is the tension due to the stress, anxiety, and depression. It is also due to the cluster headache and the migraine, which that is three type of the headache is due to the stress, anxiety, and depression. Hemicranial continua is another type, and ice pick headache and thunderclap headache. The thunderclap headache and ice pick headache can move from one region of the head to another. Allergic or sinus due to the sinusitis, which that cause a headache in the front due to the sinusitis. On the other hand, the hormonal headache is the menstrual migraine, a caffeine headache, overconsumption of caffeine, exertion headache, hypertension, rebound headache, and post-traumatic as well as spinal headache. Let's understand about the tension. Tension is the front of the upper and the lower upper of the eyelid and the lower of the forebrain, which that cause the tension headache. Migraine is the one side containing eyes as well as the upper head, while the cluster headache is due to the tension is surrounded the orbit of the eye. The allergic sinusitis due to the allergens and cause the sinusitis due to the allergic sinus headache, and this is the caffeine overconsumption will lead to cause headache in the front of the head near the eyes, both eyes. Hormone headache is due to the menstrual imbalance is the like a migraine, and on the other hand the hemicranial continua, which that is also the part of a migraine. Hypertension and rebound is the another. In this way, the hypertension will lead to front of the head, and the post-traumatic is involved the periphery of the mouth and the center of the forehead and the neck, while the exertion is like a hypertension, and the spinal is involved the neck region as well as the upper forehead, scalp of the head. On the other hand, the thunderclap and ice pick can transmit the pain. It is unable to identify the where is the pain, because pain can transmit. Let's understand about further. The attention headache is the stress often trigger like anxiety, stress, and depression, which that is here is you can see the back of the head and front of the head involved. This is the tension headache. While the thunderclap headache is due to the it can be a severe headache that come on rapidly and reached a peak intensity in under minutes and again disappear. This indication of the thunderclap headache is stroke, brain injury, reversible cerebral vasoconstriction syndrome, and vasculitis, like inflammation of blood vessel. It means the thunderclap is due to the inflammation. Inflammation will lead to cause thunderclap headache. This thunderclap headache can move, that is why. The cluster headache is the severe burning and the piercing pain due to the stress, and in this way it is surrounded the eyes, even one eyes. And in this way, this cluster headache is basically due to the also involved with the migraine, and it is also caused the stress response. Symptom we will understand in this manner: the swelling, the redness, flushing, and sweating on the side that affected by the headache, like nasal congestion and eye tearing on the same side as the headache. Let's understand about the migraine. What is the migraine? Very important to understand because is the one side of the head will be affected as a pain and one side of the sensitive to light and sound, nausea and vomiting also occur, and the visual disturbance, and that is why the one side is involved due to the tension, and it is also due to the depression and a lot more things. So remember that things. Basically, is the migraines due to the stress, like stress in the abdomen, in the digestive system also. The cause of migraine aura is the flashing light, shimmering light, zigzag lines, stars, blind spot. Exertion is here we will understand about the hypertension. This hypertension, when more high blood pressure, will lead to cause emergency, and this emergency basically the changes vision, worsen with activity, numbness, tingling, nose bleeding, and chest pain and shortness of breath. And this hypertension is very severe as well as emergency situation. If not, early treatment will lead to cause death because the stroke can occur. And on the other hand, the aneurysm. Here is the another way. Here is the hemicranial continua, which that is variability of this pain and the tearing eye, redness and tearing, nasal congestion or runny nose, eyelid dropping and forehead sweating, meiosis and the restlessness, agitation also occur. This will lead to cause, this is due to the hemicranial continua. This exertion is the intense exercise. When you will intense exercise will occur, which that will lead to exertion. Exertion involve like a hypertension, but remember that things. This is the near the eyes and upper part of the nose and lower part of the forehead. While here is the ice peak thunder clap is the migratory pain, and this moves different part of your head, and it is basically due to the inflammation. Remember, like a thunderclap. On the other hand, this is the spinal headache is the forehead, temples and upper neck also, and back of the head. The spinal headache is due to the spinal injury or some other problem, and this inflammation like encephalitis and other things. So on the other hand, here is the rebound pain is the forehead and the between the forehead, front of the forehead, which they lead to due to the tension type headaches and like migraine. And the allergic sinusitis will lead to cause allergic sinus headache, and this sinus area causes by allergic reaction like pollen allergy. This pollen allergy when progress will lead to sinus problem. The sinus inflammation will lead to cause allergic sinus headache. Hormonal headache is the women commonly and experience headaches that are linked to hormonal fluctuation like the menstrual disturbance or our menstruation or other problems like during the period. Let's understand about diagnosis first, and then we will understand the treatment through medication. The first of all, the diagnosis through identification of primary or secondary headaches, and the primary and secondary headaches when identified, we can treat well. We also understand the duration, intensity, location, possible triggers, and in this way, we can identify through MRI or CT scan, lumbar puncture, and blood test. The treatment of the headache, first we will understand the tension. The tension is involved the upper scalp of the head region, front of the head, and back of the peripheral of the head. In this way, the aspirin and the brufen and the naproxen, acetaminophen, which that is treat the tension. Cluster headache can be treated with the oxygen therapy and the sumatriptan. A local anesthetic can treat the corticosteroids and the melatonin. The cluster headache is basically due to the tension, and the cluster headache is the cause of burning and the piercing pain. So, on the other hand, the migraine can be treated with the medication, the sumatriptan and the rizatriptan and the propranolol and metoprolol and the topiramate. Hemicrania is treated with the indomethacin anti-inflammatory drug. On the other hand, the thunderclap, which that is the migratory pain, and it can transmit between the head. Beta blocker and the calcium channel blocker is important for the treatment of the thunderclap. So remember, this is our hypertension treatment, so that is why the beta blocker and calcium blocker. So I hope you make sense about the type of the headaches, how it is possible, and where the region of the headache, and what is the causes of the headache. Thanks for watching. If you like my video, please make sure to subscribe and share this video. If you want to get more videos, so please on the bell button. And thanks for watching. See you in the next video. For this time, bye.